Oh. Mm-hmm. Mm-hmm. I'm trying to think of a way to show you, but that's what happens when your lip is overfilled. Go up here. And then nobody can talk to you with a straight face because you look so weird. See, it fills up there, and then even when you talk, you don't look the same because you can't put fillers up there. You know? It doesn't look good. So, don't let people... Luckily, that was a clean sponge. Don't let people do that to you. When filler is up here, it affects the way you talk. It affects the way you move. And it can be so beautiful. It can be done so well. Little bit of filler, sometimes Botox to give you a flip. This is one place we do fillers. Other place we do it, we can put fillers in the cheek and they go along the bone. They don't go here. Like, I don't even know how to show you that. But let me try. Watch, I'll try if I can get it. And people put it right there. Watch what happens when I smile. I look like it changes the whole side of my face. It doesn't go here. Every now and then you have somebody that needs a little there, but not, see how differently you move when there's a bulk in your face? It's not meant to be bulky. It goes along your cheek. Everything goes back to how naturally you're supposed to look. Because and there are a lot of people that have this, and when they smile, they know they look different, but it's because it's matching up all the skin. The other place that filler can go pretty is in your brows. But it's all very delicate. Under your eyes. Again, very delicate. Earlobes. Oh, that can be so pretty, or it can be ridiculous. Everything needs to be done subtly. If you put it down here, you can't talk. Now you have a square face. Now you look like Snow White, the dwarf, grumpy. You don't want that. So fillers, you shouldn't be scared of them. You should be scared of them when they're not done, well, or when you don't choose a facial plastic surgeon or a dermatologist or a plastic surgeon or someone that has extensive experience with it. And you never want it here because it just kind of squares off your face. This needs a lift through here. Even babies have this line. We do put filler there sometimes, but in small amounts. And the things, it's funny because your husbands are always the ones that are the most afraid because they don't want the wife that everybody talks about, because fillers have gotten a bad name, especially in the lips. But it's not really that it's outside the lip. And so it's a delicate little muscle. It's like a plaid shirt or like the little spores in this. And you can't fill it all up or it can't move. So see, you don't want to feel think of that as the muscle that's moving. If you put a big sponge in there, it can't move. So remember that. And don't be afraid of fillers. We do them in the lips, you may be bruised for a few days. Under the eye, you can definitely bruise more because that skin is thin and you can see it, which is why it looks dark. But you just need, to give yourself about a week. The brows, it can stay a little bit sore for a minute, the cheeks, but you won't feel it for long. You might feel it for about a week. Bruising, we have lasers that we use to try to get rid of the bruising faster, avoiding things like alcohol, and aspirin, ibuprofen, green tea is a big one so that you don't bruise as much. If you can, that's a great thing to do. If you can't, a lot of people still are fine. Pineapple helps a lot because it's got bromelain in it, which is also a really good anti-inflammatory. So if you do bruise, there's certainly things you can do. Cover-ups are great. I like Shape Tape. It's you can get it at Ulta. It's fantastic. I wish I had some here to show you. But there are all kinds of ways to cover up bruising. But if you're going somewhere big, just wait. But fillers can be great. Just don't. It's sad when something gets a bad name and it's so good. So I don't have to look like that. You just don't. Not a good look.